All right, so today we're going to talk about kind of a question that comes to mind a lot with some of my patients is how come practitioner A said and gave me these recommendations, whereas practitioner B said these other maybe competing recommendations? Well, sadly, there's no good answer to why that is. Oftentimes, it just boils down to who has the bigger knowledge base of what they're doing. So, when it comes to each individual practitioner, depending on what specialty they have and what extra education they've taken throughout the course of their career, one practitioner might know a little bit more with a certain condition compared to another. So sometimes that puts you, the patient, in the position where you have to do that little bit of research and kind of say, who has the best knowledge base for my specific condition? And keep that in mind. Knowledge base is only as good as what you're studying for. So if you have lots of education, but it's not in the domain that you're actually seeking help for, then a lot of that knowledge is not necessarily good for what you're looking for. So you really do have to pay attention to what is the condition that you're seeking help for and who has the best or the most education or knowledge in that subset. Now, it really is up to the practitioners to be a little bit humble themselves with regards to the patients. Sometimes it's good for practitioners to know that we don't know everything. Of course, when it comes to my patients, one of the things that I find always holds true is if you're doing a therapy and it's so far giving you positive effects, it's making you improve upon your current situation, well, that's usually a good thing, and I usually recommend to keep going with it. If you're always getting negative outcomes with the therapy you're doing, well, then there's going to come into question how effective is the treatment you're receiving. So, even though there might be some conflicting information from practitioner to practitioner, sometimes, yes, it is good for the practitioners to kind of work well with themselves, and oftentimes that is the case. And then sometimes it's good for you as the patient to make those kind of informative decisions with regards to maybe you're going to trust one of the practitioners for now because they have a higher maybe education base in it. And if you don't end up where you're meaning to go, you kind of maybe try route B and see where that leads you. It is an imperfect system, but there's no doubt that everyone's trying their best to help you. So it's just kind of up to you to try, hopefully make the best decision as you can.